Bismillahirrahmanirrahim. Assalamu alaikum. Here I am Dr. Fana Sami. Today's our lecture topic is infectious disorders of the liver related to hepatitis B, hepatitis C and hepatitis D. Learning objectives of the lecture include introduction of the infectious disorders of the liver, the structure, epidemiology, routes of the transmission, replication and pathogenesis, signs and symptoms, diagnosis, prevention and treatment of each hepatitis B, C and D. At the end of this lecture, you all must be able to explain all these things. Hepatitis is an inflammation of the liver cells, which can be caused by the different things like the drugs or the excessive intake of the alcohol, and it can also be an autoimmune infection. But viruses causes most cases of the hepatitis. Among all these, the viral hepatitis is classified as the acute hepatitis and the chronic hepatitis. Acute hepatitis is self-limited liver injury of less than 6 months time period, while it is caused by the different types of the hepatitis viruses, among which hepatitis A virus always causes acute hepatitis, while chronic hepatitis is again an hepatic inflammation for more than 6 months time period, and the hepatitis B and C and D are most likely to become ongoing and chronic infections. Types of the hepatitis virus. There are many hepatitis viruses. Actually, many viruses are responsible for causing hepatitis infection. But these 5 viruses are called as the hepatitis virus because their main site of the infection is in the liver. Today we will do hepatitis B, C and D because as you have done hepatitis A and E in your previous lecture about the acute hepatitis. Source of the virus in all these 3 is actually the blood and the blood-derived body fluids. In all these B, C and D, the source of virus is the same. Similarly, route of the transmission is also same. So in all these cases, percutaneous and the permucosal transmission is there. And the chronic infection is also caused by all these 3 types of the hepatitis viruses. Prevention is good in case of the hepatitis B virus. Pre and post exposure can cause the immunization. So, but in case of the hepatitis C and D, there is no such immunity. So the blood donor screening is necessary and the risk behavior modification is necessary to protect from these infections. Here you can see the different structures are present here, and these all are belonging to the different types of the hepatitis viruses. You can see here a difference between all these and the hepatitis B virus. All the viruses are RNA viruses except this hepatitis B virus, which is actually a DNA virus because it has got a DNA genome. Hepatitis B virus. Liver diseases due to the hepatitis B virus is an enormous global health problem. Actually, hepatitis B infection is a very serious and a common infection in the world. It is actually responsible for causing the 1/3 of the world population infected with this virus, and that is about 2 billion people have been infected with the HB virus, and about 400 million people have the chronic infection, among which 25% actually are getting the hepatocellular carcinoma too. 75% of the all chronic carriers live in the Asia and the Western Pacific Rim. Global prevalence of the chronic hepatitis is varied widely from high, that is about more than 8% in the Africa, Asia and the Western Pacific area, to intermediate about 2 to 7% in the Europe, and also less than 2% in the America and the Australia. Hepatitis B virus can produce acute hepatitis followed by recovery and clearance of the virus. It can produce non-progressive chronic hepatitis. It can produce chronic disease which is of progressive type, and which will end in the cirrhosis. Acute hepatic failure with a massive liver necrosis can also occur, and asymptomatic healthy carrier state can also develop. HPV-induced chronic liver disease is also an important precursor for the development of hepatocellular carcinoma, in the absence of the cirrhosis. So it can produce 4 types, both the non-progressive as well as the progressive chronic disease. Important properties of the hepatitis virus include that it is a member of the hepatinovirus family, which is a DNA virus family, and it is a 42 nanometer envelope virion, and it has got icosahedral nucleocapsid core containing a partially double-stranded circular DNA genome. Partially double-stranded circular DNA means that something deficient in the double strain. Actually, one of the strain of the double-stranded circular DNA genome is somewhat deficient in a very small portion. The envelope contains a protein called the surface antigen, HPS antigen, which is important for the laboratory diagnosis and immunization. The DNA polymerase present in the core has both the RNA-dependent reverse transcriptase and the DNA-dependent activity. This is the structure of the hepatitis B virus. You can see in the left side, this is the whole virion. In the inside, there is a red color double-stranded DNA genome, which is, you can see, is deficient at the one portion in the one single strain. This is the reason it is known as the actually partially double-stranded DNA genome. Okay, and then there you can see there is a blue colored dotted surrounding lining a core, that is a capsid, and in between these actually red colored double-stranded genome and blue colored core, there are black colored dots which are actually the hepatitis B E antigen, and the blue colored core is consisting of core antigen, that is HPC antigen. Here you can see there is a surrounding envelope. The envelope has been taken from the host cell, but there are also surface antigens, red colored spherical portion and the white colored filamentous portion is actually indicative for the hepatitis B surface antigen, HBS antigen. On the right side you can have these structure separately, a spherical portion of it and the elongated portion. This is actually filamentous portion is only produced by the hepatitis B virus. No any other hepatitis virus can produce. This is actually non-infectious portion of the virus because there is no DNA in this portion. Den particle is whole virion is a den particle actually. You can see the HPS antigen actually is a surface pore protein. It has got the 4 phenotypes ADW, ADR, AYW and AYR. These phenotypes are important from the epidemiological point of view because in some areas they are in the very much concentrated amounts. So we can have idea about the infection in those areas. Then HPC antigen is a inner core protein, a single serotype, while HBE antigen is a secreted protein which is actually function of it is unknown, but its presence in the blood is actually indicative for the infectivity of the infection. So high transmissibility is indicated by this presence of this antigen in the blood. The genome contains 4 genes, 4 open reading strands that encode the 5 proteins. S gene which encodes the surface antigen, then the C gene which encodes the core antigen and also the E antigen. Both these antigens, core antigen and the E antigen are present in the capsid, core capsid, while the P gene encodes the polymerase and the X gene encodes the X protein. HPX is an activator of the viral RNA transcription and may be involved in the oncogenesis because it can inactivate the P53 tumor suppressor protein. Here again I have shown you the structure, the virus particle as well as the surface antigen particle. Replication of the hepatitis B virus. It starts with the attachment of the virion with the hepatocytes on their specific receptors which are present on the hepatocytes. After attachment they get entered into the cell where they become uncoated, and this uncoated nucleocapsid will enter and it will move towards the inside the nucleus of the host cell, where the DNA polymerase will actually form the missing, it will synthesize the missing portion of the DNA single strand, and it results in the formation of the complete DNA double-stranded genome, which is also known as the covalently closed circular DNA genome. Now this DNA will serve as the template for the formation of the mRNA. When the multiple individual mRNAs are formed, they will form a long mRNA. That mRNA will move outside the nucleus and go towards the cytoplasm, where they will act as the template for the minus strand of the double-stranded genome of the progeny virion. And that minus strand will act as a template for the formation of the positive strand of the DNA. When these both are formed, they will actually, its whole process is occurring inside the newly formed nucleocapsid. Now this assembling of the nucleocapsid will occur, and after completion of the assembling, the virus will actually progeny virus will come out of the cell, and it will leave the host cell by budding out of it. There will be no destruction of the cell, but the progeny cell, the progeny virus will come out by the budding process and will go towards the other cells to infect them. Here this actually histopathologic picture is present. This is showing the ground glass hepatocyte inclusions. We can see actually when there is a formation of the new progeny virus is occurring during the replication, the excess surface protein is formed. This excess surface protein gives a ground glass hepatocyte enclosure appearance to the liver cells, in which here you can see a hazy flat cytoplasm is there, and there is a granular portion also. So this granular portion is because of the presence of the surface antigen. Mode of the transmission of the HPV. It includes sexual, parenteral, and the perinatal. Sexual, actually sex workers and the homosexuals are at particular is a risk, and the parenteral, in this case the intravenous drug abusers and the health workers are at the increased risk. Perinatal, here actually mothers who are HPE antigen positive are much more likely to transmit the infection to their offspring than those who are not HPE antigen positive. Perinatal transmission is the main means of the transmission in the high prevalence population, as in the Africa, in the Asia, in the Western Pacific areas. Risk factors of the hepatitis B virus include close contact with someone who has hepatitis or who is carrier for the hepatitis infection. Babies born to mothers with the hepatitis B and C. People who use IV drugs or share the needles. Getting one or more blood transfusions, blood products, or organ transplants, mainly before 1992. Because after that, the screening of the donor blood was started, which has reduced the such cases. The hemodialysis to treat the kidney diseases can be the risk factors. Exposure to the unsterilized items like the medical equipment, tattoos, or the baby body piercing tools can be the risk factors. A weak immune system from a disease or treatment, because the immunosuppressive chemotherapy can also cause weak immune system. And sexually transmitted infection or the HIV, if already present, then they can be the risk factors for HPV virus. Risk factors for the progression of the chronic HPV include the following: persistently elevated levels of the HPV DNA and, in some patients, alanine aminotransferase (ALT), as well as the presence of the core and the P core mutation seen most commonly in the HPV genotype C and D infections. And the old age is also important in this case. Pathogenesis of the hepatitis B virus. Virus enters the blood, it infects the hepatocyte, then viral antigen displayed on the surface of the hepatocyte. In response to it, cytotoxic T cells mediate an immune attack against the viral antigen, which results in the inflammation and the necrosis of the hepatocyte. All this process is indicating that the pathogenicity of the hepatitis B virus is probably due to the cytotoxic T cell mediated immunity, while the HPV virus itself does not produce any cytopathic effect. Antigen-antibody complexes can cause some earlier symptoms like the arthralgia and urticaria and the arthritis, and some complications in the chronic hepatitis like the glomerulonephritis and the vasculitis. Chronic carriers actually are mostly the 5% of the adults, in contrast to 90% of the newborns becomes chronic carriers. This huge difference in the percentages is because the newborns actually have not established competent immune system, so they cannot compete with the viral infection viruses, so they become chronic carriers, while the adults have got the established competent immune system, so they can compete and fight against the virus. So they only the 5% becomes chronic carriers due to the different reasons. Actually, chronic carriers means the presence of the HBs antigen in the blood for more than 6 months. Actually, chronic carriers can progress to the active chronic hepatitis 2 because the HPV and the HPS both are present there. And the patient actually becomes non-infected and becomes normal, and it clears the infection or not. It depends on the adequacy of the cytotoxic immunity. And the chronic carriers they can develop the hepatocellular carcinoma too. Actually, it is because the the cells which are actually damaged in response to it, the hepatocytes can try to can attempt to replace those dead hepatocytes, and in this way the overgrowth can occur and the loss of the control to the growth can occur. And secondly, HPX antigen can be oncogenic because it inactivates the p53 tumor suppressor gene, and thereby it acts as an oncogenic factor. And alternatively, the malignant transformation can also occur because of the insertional mutagenesis, and due to the reason because the HPV DNA integrates into the hepatocyte DNA, and it can actually be seen. It has been seen actually. The almost all the hepatocellular cells, hepatocellular carcinoma cells, are having the integrated DNA in them. This is the potential outcome of the hepatitis B infection in the adults. Acute infection can lead to subclinical disease or acute hepatitis or chronic hepatitis. 65% cases can lead to the subclinical disease, and which can lead to recovery. Most 100% it will aid in the recovery. But the 20% cases can produce acute hepatitis, among which 99% will be able to recover. But the 1%, even less than 1%, can produce fulminant hepatitis, which is actually fatal and needs transplant of the liver for the survival of the patient. And the 5 to 10% can develop chronic hepatitis. Among these, recovery can occur but very low. But the patient can recover if it is actually treated in a right way. And the chronic hepatitis can lead to produce the cirrhosis in 20 to 30% cases, while 2 to 3% cases can develop the hepatocellular carcinoma too. In these two things, cirrhosis and hepatocellular carcinoma is important. As cirrhosis can develop, cirrhosis can also develop the hepatocellular carcinoma, and it can also become fatal too when there is a huge damage because of the cirrhosis. So the hepatocellular carcinoma and the cirrhosis also can become fatal or require transplant of the liver for the survival of the patient. Clinical manifestations. Actually, incubation period is 4 to 26 weeks. And the signs and symptoms include the fever, fatigue, loss of the appetite, nausea, vomiting, abdominal pain, dark urine, clay colored bowel movements, joint pain, jaundice, hepatomegaly. So patient may be asymptomatic or may have some of these uh, sim, uh, symptoms, signs and symptoms, or some can have the all signs and symptoms too. Diagnosis of the hepatitis B virus. A series of the serological tests are used for the diagnosis of the acute and the chronic hepatitis B infection. So the hepatitis B surface antigen, it is used as a general marker of the infection. Hepatitis B surface antibodies used to document recovery and or immunity to the HBV infection. Anti-HBC is a marker of the infection. Its presence shows the infection, but it is for the two types of the antibodies. So it can be IgM antibody, it can be IgG. If the IgM form of the anti-HBC is present, it is marker of the acute infection and the active chronic infection. While if the IgG form of the anti-HBC is present, it shows a past infection or the chronic carrier state. HBe antigen indicates the active replication of the virus because it is always produced or secreted during the replication of the virus, and therefore it shows the infectiveness and highly transmissibility state. Anti-HBe antigen, this is the antibody against the HBe antigen. Virus no longer replicating, it is indicated by this. However, the patient can still be positive for HBs, which is made by integrated HBV. So when anti-HBe are there, they are showing the infection is going to be ended. HBV DNA indicates active replication of the virus, more accurate than the HBe antigen, especially in the cases of the escape mutants, used mainly for the monitoring response to the therapy. Serological test results in the 4 stages of the HBV infection: acute disease, window phase, complete recovery, and the chronic carrier state. HBs antigen and the HBs antibodies and the HBc antibodies. So in the acute disease, HBs antigen and the HBc antibodies are always positive, but the HBs antibody will be negative because it will take time to form against the HBs antigen. But while in the window phase, both the HBs antigen as well as the HBs antibody will be absent. Only the indicator of the disease is the HBc antibody. Window phase is what? It is a time period during which the HBs antigen and HBs antibodies both disappear, because they are actually undetectable. There are HBs antigen, there will be HBs antibody, but in the very low concentration, because most of them are busy with each other. They are forming the antigen antibody complex. Then the complete recovery. In this case, the HBs antigen will be absent, HBc antibody will be positive, and the HBs antibody will be positive. Now we can have something that we should clear that the HBc antibody present in the acute as well as in the complete recovery. But as I told you, there are 2 forms of the HBc antibody. So in the case of the acute phase, there will be the IgM anti-HBc, while in case of the complete recovery, there will be IgG anti-HBc. Similar will happen in the chronic carrier state. There it will be positive in this case, but there is also IgG anti-HBc over there. If it is a chronic carrier state but not active state. In the active state, it will be IgM. So it depends what type of the state is this at that time. In the chronic care state, it should be present. While HBs antigen is present here, but the HBs antibody will be negative. Acute infection without resolution. So you can see the different serum markers. Serum transaminases have increased. There are increased HBe antigen. This is the highly transmissible antigen, and then the HBV DNA is there. HBs antigen is increased. There will be the jaundice and the other symptoms may also occur in this time in the acute disease. When it is proceeding towards the convalescence, then in this stage, in this recovery stage, the antigens will disappear, like the HBs antigen will disappear and HBe antigen will disappear. Antigen HBs will disappear, but the antibodies against HBs will be there. Antibodies against HBe will be there, and the antibodies against HBc will also be there. Here, in the progression to the chronic infection, again serum markers you can see, but what's the difference? We can see the HBe antigen and the HBV DNA, HBs antigen which are present in the acute phase. They are still present in the chronic disease phase. So there is anti-HBe but HBe not showing that there is no antigen again present. Actually HBe antigen is also there and HBV DNA is there. So if the DNA is there, means the chronic disease, especially chronic active disease is there. So IgM anti-HBc will be there, which is showing the infection is present in case of the acute disease, but anti-HBe will be present even after the acute state. Well, HBc antibodies can also be present. Total anti-HBc antibodies can be seen over this. The blue line is showing the anti-HBc antibodies. So along with the antibodies, there will be also antigens in the chronic disease, which are absent when the recovery phase was there. Prevention, very important thing. Vaccination is important for this. Highly effective recombinant vaccines are now available. Vaccines can be given to those who are at increased risk of the hepatitis B virus infection, such as the healthcare workers. It is also given in the routinely to neonates as a universal vaccination in many countries, and it has become very effective too. Hepatitis B immunoglobulin, it may be used to protect the persons who are exposed to the hepatitis B. It is particularly efficacious within 48 hours of the incidence, so it should be given within this time period. It may also be given to neonates who are at increased risk of the contracting hepatitis B, whose mothers are HBs antigen and the HBe antigen positive, because there is a high transmissibility of the disease to the offspring from the mothers who are positive for the HBe antigen. Other measures include the screening of the blood donors, blood and the body fluids. Hepatitis C virus, it belongs to family Flaviviridae. Genus is the Hepa C virus. This virus is a small tiny virus about 60 to 80 nanometer in diameter. It consists of an outer envelope. You can see a brownish colored envelope is there, and there is also blue colored icosahedral core. You can see inside the envelope. While in linear positive polarity single stranded RNA genome, you can see inside the blue colored core. There are thread-like, pink thread-like structure. There are 6 major genotypes of the virus 1 to 6, but there are multiple subgenotypes are also over there, which can cause the actually multiple changes and form a hypervariable region in the important surface proteins of the virus E1 and the E2. Hepatitis C is an infectious disease. Hepatitis C virus attacks the liver cells, leading to inflammation. Hepatitis C virus is a major cause of the liver diseases worldwide. That is actually approximately 170 million people have infected with this. About 350,000 to 5 lakh die due to the chronic hepatitis C infection each year. Though annual incidence of the infection is decreased now due to a marked reduction in the transfusion associated cases because of the routine screening of the blood donors. As the body is unable to get rid of the virus, most of the HCV infections are becoming chronic. On the basis of the data got from CDC in the United States, actually the most common risk factors for the HCV infection are multiple sex partners, having had surgery within the last 6 months, and the individuals who actually have got the needle stick injury, and those having multiple contacts with the HCV infected persons, and the employment in the medical or the dental field. There are also some unknown risk factors, or you can say without any risk factors, the individuals are getting disease. Antibodies against the HCV are made. Even then, approximately 75% of the patients are chronically infected and continue to produce virus for at least 1 year. And 20% of them actually get cirrhosis. It takes time, but after a long period, about 20 years, they are getting cirrhosis. Hepatocellular carcinoma is also very much common in these cases. Why the antibodies against HCV which are made are not actually advantageous? Because the subgenotypes are undergoing multiple mutations, and they are producing a hypervariable region in the surface glycoproteins or envelope proteins of the virus, like E1 and the E2, especially in the E2. And this actually results in the occurrence in the formation of quasi species, which is actually a genetic variant known as quasi species, and it is very closely related to the HCV. Pathogenesis, actually incubation period of the disease is about 2 to 24 weeks. HCV first infects the hepatocytes primarily, but there is no evidence for virus-induced cytopathic effect on the liver cell. Rather, the death of the hepatocytes is probably caused by immune attack by the cytotoxic T cells. HCV infection strongly predisposes to the hepatocellular carcinoma. This cancer is caused by prolonged liver damage and the consequent rapid growth rate of the hepatocytes as the cells attempt to regenerate, rather than by a direct oncogenic effect of the HCV. And this actually idea or the concept theory is supported by the fact that the alcoholism is mostly leading to the hepatocellular carcinoma in the patients having the HCV infection, chronic HCV, and also the cirrhotic infection, which are not only the alcohol. There is a cirrhotic patients. They are also getting this disease mostly. Actually, in these both cases, the massive damage to the hepatocytes occur, due to which the cells attempt to regenerate, and a loss of the control to the growth occur, which lead to hepatocellular carcinoma. Here you can see progress of the events in the HCV. HCV infection 100% is there when it will lead to see acute infection first in 25% of the cases. 75% case remains subclinical and it remains unnoticed. There will be persistent infection in the 85 to 100% cases, but it is missed because they remain asymptomatic mostly. Acute hepatitis can lead to persistent infection, but it can also lead to fulminant hepatitis, which is mostly very rare, but it's fatal. It requires transplant of the liver. Persistent infection will lead to chronic hepatitis in 50 to 70% of the cases, and after about 20 years it will be actually responsible for producing liver cirrhosis. 12 to 25% cases develop liver cirrhosis, and among these 1 to 5% will get liver cancer, and 2 to 5% actually can have other end stage liver diseases like the renal failure. Extrahepatic problems can also occur in the 7% cases. These include the arthritis, skin problems, glomerulonephritis, and the cryoglobulinemia. Laboratory diagnosis. HCV antibodies generally used to diagnose hepatitis C infection, but it is not useful in the acute phase as it takes about 4 weeks to appear. Actually that's why we can't use it for the acute phase. HCV RNA, various techniques are available for this, PCR and branched DNA, and it may be used to diagnose HCV infection in the acute phase. However, its main use is in the monitoring the response to antiviral therapy. HCV antigen and immunoassay, enzyme immunoassay for the HCV antigen is available, and it is more easier to carry out. That's why it is done, and it is used in the same capacity as the HCV RNA test. Hepatitis C virus, actually for this there is no prophylactic vaccine and specific immunoglobulin against hepatitis C, but the effective antiviral treatment exists, which is disease prophylaxis as well. But some actually attempts can be done to reduce the infection. For example, screening of the blood organ tissue donors. So the high risk behavior modification is also helpful. The blood and the body fluid precautions are also important. Treatment. It has got treatment. Interferon may be considered for the patients with the chronic active hepatitis. The response rate is around 50%, but 50% of the responders will relapse upon withdrawal of the treatment. Ribavirin, there is less experience with the ribavirin than interferon. However, recent studies suggest that a combination of the interferon and the ribavirin is more effective than the interferon alone. And you can have some new drugs which have been produced. Some are under production, some have been produced. So you can see oral drugs for the chronic HCV infection. RNA polymerase inhibitors like sofosbuvir, desabuvir, which is also RNA polymerase inhibitor, but mechanism of action of both is somewhat different. Sofosbuvir actually inhibits the synthesis of the genome RNA nucleosides, and while the desabuvir inhibits the synthesis of the genome RNA non-nucleoside inhibitor. NS5A inhibitor are also very important, like ledipasvir, ombitasavir, and the declatasavir. They inhibit the synthesis of genome RNA, blocks action of the NS5A protein, that is the cofactor required for the RNA polymerase activity. There is also protease inhibitor. You know, protease is important during the replication, very important. So the bosipravir, simpravir, telepravir, pachiravir, these are the drugs which are used. They inhibit the cleavage of the precursor polypeptide, blocks the production of the function HCV structure and the non-structural proteins. So there will be no assembling of the progeny virion will occur, and no new virus will be produced when it will be inhibited at this level. Or the hepatitis D virus. HD virus is an enveloped virus. RNA genome is single-stranded, negative polarity, covalently closed circle. The RNA genome of the HDV is very small and encodes only one protein, the internal core protein, which is known as the delta antigen. Actually, this virus has no any own surface protein, envelope protein or envelope antigen. So it requires help of some other virus like the hepatitis B virus to replicate. So you can see in this structure, the outsider blue colored surface antigen are actually the hepatitis B surface antigen. As the hepatitis B surface antigens don't have DNA, so they can be used easily by the hepatitis D virus because they are non-infectious, so they can be taken by them and will be helpful in the replication of the hepatitis D virus, which has got its capsid protein, that is the delta antigen, and also RNA genome, which is a delta virus. Most of the transmissions are actually similar to those of the hepatitis B virus. Percutaneous exposure, injecting drug use, and the per mucosal exposure, sex contact. Here at the side you can see in the picture how the actually hepatitis D is getting the surface antigen of the hepatitis B virus. Here you can see the DEN particle is there, polymerase is there, DNA is there in the structure of the hepatitis B virus, and hepatitis B virus are actually showing its HPS antigen. As I have told you, there are two parts of the HPS antigen, spherical and a filamentous. From the spherical particle, the hepatitis D virus will get actually surface antigen and will replicate. So it always needs help of the hepatitis B virus to replicate. It cannot actually grow or replicate itself. So this is known as a defective virus. Clinical features are the infections which are caused by it, actually are of the two types, co-infection and the superinfection. Co-infection is a severe acute disease. Low risk of the chronic infection is there. There actually hepatitis D virus infection and the hepatitis B virus are occurring simultaneously. Second is the superinfection, which really develops chronic HCV infection. This is the high risk of the severe chronic liver disease. It may present as an acute hepatitis. Actually, it is the infection of the hepatitis B virus which occurs a long period after an infection of the hepatitis B virus. It will actually infection. It will cause super infection along with the hepatitis B virus. Preventive measures actually hepatitis B virus and HD virus co-infection can be prevented by the pre or the post exposure prophylaxis to prevent the HPV infection. When there will be no HPV infection, there is no chance of HPV infection. HPV super infection, and education to reduce the risk behavior among the persons with the chronic HPV infection is necessary. But if prevention of the HPV is actually prevention of the hepatitis G virus.